All right, Dr. Shetty, if you could please tell us about your existing projects.
Yeah, we have hospitals in about 30 locations. We have close to 7,000 beds. So about 12% of the heart surgery done in India is done by us. Essentially, we are healthcare providers for working class and poor people. That is the section of society we address predominantly. Yeah.
Right. Dr. Shetty, how do you think we can go ahead and overcome the gap which is there, the rural versus the urban gap in the healthcare sector?
See, there are 100 towns in India with a population of 500,000 to 1 million where there is no super specialty hospitals. And it's not very expensive to build these hospitals. So essentially, government should take it up as a priority to build 200, 300 bed super specialty hospital, either run it themselves or run with on a public-private participation. Building AIIMS-like institution in place like Delhi or in state capital is not going to address this issue. It's pointless spending so much of money in one building because people have to travel from one part of the state to the other part of the state, stay in a new city. Cost of stay itself can exceed the cost of healthcare and
That
the
is what
inconvenience.
usually it is.
Yeah. So we need to be, government should build hospitals very close to the patients. And this hospital, it doesn't matter who runs it, the government themselves can run it. So unless these infrastructure comes up, and also government should change the policy of medical education. We have to equalize UG and PG seats, otherwise you won't have gynecologists, pediatricians in those small towns.
Right. What is the extent of technology leverage your organization is going ahead with, like big data, cloud, and this is in context of helping the marginalized communities?
See, the entire concept of technology has undergone dramatic change with the mobile platform. Earlier, every doctor needed to go to a corner of the hospital where there's a computer, get the data or access the data. Today, all those things are available in the mobile phone. So we are heavily investing on mobile-based technology, wherein we can communicate with large number of doctors about a particular patient, and the data will move seamlessly. You don't need to physically carry an X-ray from the X-ray room to the patient's ward. It will come automatically online, and you can see the X-ray in your phone. So essentially we have invested heavily on cloud-based solutions and mobile platform. That is going to be the future. That is the advantage India has. We can really leapfrog the technological changes compared to US hospitals, which are still saddled with all this legacy software and the importance of all these mainframe computers managing the healthcare data.
Right. You spoke about private investment. Healthcare, here we have the FDI has opened up in healthcare sector. Do you think it has helped?
Unless the medical education gets transformed in the country, unless we equalize the UG and PG seats in medical colleges, it's pointless investing in healthcare. You will have buildings, but there won't be doctors, there won't be nurses, there won't be any healthcare related activity. We'll be stuck, and it's going to happen soon. You just need another 3,000, 4,000 beds to come up in the country. Then you will find that like the European Football League, where the players are poached from one club to the other club. That's what we are doing today.
So what is the solution?
You see, we have 50,000 undergraduate seats and only 14,000 PG seats. US has 20,000 undergraduate seats and 40,000 PG seats. We need to have double the number of PG seats. Then not only Indians, doctors from Africa, other Asian countries will come. They will work in remote locations. They take care of the primary, secondary healthcare needs of the country. And this is how we went to England. We worked in those hospitals. We got the training. We came back and served our country. Those African doctors will come here. They go to remote locations. They serve the people. We have to open the medical education.
All right. And how do you think the major challenge of accessibility and affordability can be taken care?
We just need right policies. This country is blessed in having wonderful entrepreneurs, great doctors, and the concept of caring. But we are stifled because the policy restrictions. There simply aren't that many people available to take care of the people in pain.
All right. What are your thoughts on Swasth Bharat to Sabka Vikas?
These are all great schemes, but then it has to be implemented. We need to feel the change. And it's a great concept by a great leader. But then execution is the issue. In the end, all of us can launch schemes. We can make big statements, but ultimately we have to see it happening on the ground.
Right. Do you think 100 smart cities would solve some problems of the healthcare sector? Because I'm sure hospitals would be an integral part of it.
Definitely it will help. Definitely it will help. But you see, the healthcare doesn't require money. All it requires is the right policies. Yeah, money is, you double the budgetary allocation of healthcare from current 2% to make it 10%. It's not going to reduce the maternal mortality. Women are still going to die because simply there aren't that many gynecologists, aren't that many pediatricians. And you can't buy these doctors. It takes 15 years to train a hand surgeon, forget about a heart surgeon.
All right. What are your expectations from this government?
I believe, I'm convinced government is taking the right steps. It's too early for us to judge the government. They're taking the right steps. I'm optimistic, but we have to wait and see.
So anything else you would like to add regarding the existing healthcare scenario in India, and what's the way forward in terms of technology?
I believe that we have to look at how do we reduce maternal mortality, how do we reduce infant mortality, how do we give better healthcare to rural India. Unless we address those issues, building heart hospitals, building the AIIMS-like institutions is not going to solve the problem.
Do you think increasing the budget of primary healthcare 30% is the usual amount every year for the allocated budget?
It is not going to make a difference. It is not going to make a difference because our healthcare today is revolving around doctors with a title called MBBS. And these doctors do not want to go to villages. In Karnataka state, yesterday they were celebrating that President of India had signed a law that doctor will be forced to work in villages. If you have to force a young doctor to go and work in the village, do you think he will honestly take care of the patients? There are over 7 lakh Ayush doctors who are qualified like me. All they need to do is to prescribe 47 drugs what is required. You change the policy, let them take care. All over the world, primary health care is taken care by the alternative medicine specialists, nurse practitioners, physician assistants. 67% of the anesthesia in US is given by nurse anesthetists. Here we don't allow a nurse who worked in the ICU for 25 years to prescribe one basic antibiotic.
So do you think the policy change will happen?
There is no choice. It has to be done. Sooner it is better. And I'm optimistic this government will bring about those changes.
All right. Dr. Shetty, if you could tell us about some of your existing projects and if there is any corporate social responsibility in healthcare.
Our target is to build thousands of primary health centers across the country where a qualified doctor will be there with the basic investigations, basic medicines, and with the IT enabled infrastructure so we can monitor the quality. And that is very important. That is one of the very important activity. Another activity we have is a program called Udan, wherein we want 2,000 to 5,000 children from rural India. When they are 13-year-old, they should commit to us. They will become doctors, and we mentor them. So we are trying to get these children from poor families to become doctors. That's something which is very close to us. Now you must be thinking, why children from poor families to become doctors?
No, not at all.
It is important because outstanding doctors across the world with the magic in the fingers, they come from deprived background. Because these kids have fire in the belly to work 24 hours a day and to prove themselves and change the rules of the game. But unfortunately, those children today are not willing to join the medical college because they think it's too expensive.
Right. So how are you going ahead? How is information being provided to them? What's the medium?
See, we work with the government schools, and we have a lot of NGOs coming for philanthropists donating money. All we do is to give them a scholarship for 500 rupees per month, and we mentor them. We bring them to our hospital at regular intervals. They see what hospital is. They get excited as kids. So the idea is to lure them to join my profession.
Okay. with existing scenario, do you think government's expectation healthcare for all by 2028 is possible, because then we would become the most populous country in the world?
You don't need to wait that long. We can do it in less than 5 years. And we can do it without any additional budgetary allocation. But just change the policies of training doctors, nurses and technicians. That's all. And don't come on the way of technology in the name of privacy and all the other issues. That's all you need to do.
Right. Well, the policies that you're talking about, it would also engulf the education sector. We have regulatory bodies, UGC and IICT, going ahead and providing degrees. Do you think this would really happen? And if so, what complete reform needs to be there?
See, essentially, any policy you make, you should look at the villager in rural India. What is aspiration? What he wants, what he needs. You address that. Don't worry about people living in cities. They are smart enough to take care of themselves. So if the policy is revolving around how a villager can access healthcare, if a policy revolving around how a villager's son or a daughter wants to become a doctor or a nurse, do they have access to it? That's all we need to do.